Kia ora, ko ai au, ko pokitohu no tuku maunga, ko tau mārere tuku awa, ko ngā tuki matawhaurua tuku waka, ko ngā puhi tuku iwi, ko Ngāti Manu tuku apu, ko Jessie tuku ingoa. So kia ora, my name is Jessie and I've completed the Certificate of Health Science, Hikitia Te Ora. I've taken a more alternative route to coming to university. Unlike many, I'm not a high school leaver. I've spent the better part of over half a decade serving my community as a pharmacy technician in community pharmacy. I hail from the beautiful Bay of Islands in Northland, where I've been surrounded by my whānau and my family and all my friends for my entire life, and they've been super supportive. I chose the University of Auckland because it was closer to home. I'm from the winterless north, so the cold just isn't for me. I think as well, the University of Auckland was a big opportunity for me to push myself out of my comfort zone. As I've mentioned, I come from Northland up in the Bay of Islands, which is a really rural area. So coming to the big smoke, the Great Tamaki Makaurau, was definitely a challenge for myself, but one that I was ready to take on. For rangatahi Māori, like myself, who come from rural areas, it's really hard to make that jump to the big smoke here in Tamaki Makaurau. What the Certificate of Health Science has done for me is it's allowed me to establish a network of people that I can call on and turn to for support, so I can face the challenges of a bachelor's degree within a network that I'm so readily supported by at home, just here now in Auckland. There's so many to choose from. For myself, it's getting to meet the amazing academics who are just walking around campus right next to us. Another highlight is being able to engage with my culture and being taught in a culturally safe manner where I can just be myself, I can just be Māori here in this space, and it's really encouraging. The Hikitia Te Ora program really allowed me to feel like I was returning home while coming to a really foreign space. I want to give back to my people. I want to give back to the community that has given me everything. Up in rural Northland, we're really struggling, and it's because no one wants to leave the bustling Tamaki Makaurau. It's really hard to draw people out of the big cities into our beautiful rural areas for more than just summer. And for myself, I couldn't imagine learning all this amazing information about health and how to help people and not give back to the people that have given me so much. Northland also has the biggest demography of Māori population in New Zealand, and so in order to address the health inequities that currently exist for tangata whenua, I believe having the biggest impact will be returning home where all of our people are. I think it's important to know that MAPIS is more than an admissions scheme. It's a complete social network that will help encourage you overcome any challenges that you face here at the university. MAPIS for me is a whānau, and the biggest hesitation or reservation for me coming to higher education was leaving my support networks, but MAPIS provided a loving support and helped fill that gap while I'm here in Tamaki. Studying at the university has allowed me to enter a space of higher education and reconnect with my tupuna. Our people were academics, they were scientists, and this space isn't a foreign space. It is more like a return and call home. So if you're considering studying at the University of Auckland, it's important to know that there's a place here for you and you deserve to be here.